Hello, good morning, good afternoon, good evening everyone. Welcome po sa ating 86th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Today po is our very first episode for the buwan ng pag-ibig, ang buwan ng Pebrero po, buwan ng pagmamahal. At maraming salamat po sa lahat po ng nagiging part po ng ating credible online community and to all those who have just discovered us for the very first time. Welcome po at sana po masayahan po kayo at marami po kayong matutunan sa ating webinar series. Sa umpisa po ng Omicron surge ng mga banda pong mga Disyembre, tumama po sa atin ang strongest typhoon of 2021. It caused displacement of a little over 9 million people, raising concerns about increased exposure to SARS-CoV-2 or the COVID-19 virus in evacuation centers po. Typhoon Odette, as it is more popularly known, hit the Philippines with winds at 160 miles per hour, affecting 11 of the 17 regions and also affecting 514 municipalities where 36 million homes were damaged. By the middle of January, estimated po na mahigit 150,000 po sa ating mga kababayan ang naninirahan sa evacuation centers. Marami pa rin po sa ating mga komunidad, lalo po sa Visayas and Mindanao, ang wala pa rin pong tubig o kuryente na stable, and 220 health facilities po ang nasira dahil po kay Typhoon Odette, including po 33 major hospitals. Vaccination programs po also had to be rescheduled in terms of the rollout. May mga natigil din po. So, para po sa ating topic for today's webinar, we will be asking the question, COVID-19 na? May bagyo pa. So, paano na? If you are looking for the latest science-based and evidence-based information from the most distinguished experts, keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. And also, I get to share hosting duties with our adjunct research faculty from the National Telehealth Center. Also, the Special Envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Good afternoon. Magandang hapon po sa inyong lahat. Saan man kayo naroon, binabati namin kayo. We've got really very good guests today. Pinento nga ni Raymond na maraming mga lugar pa rin sa Pilipinas na hindi pa nagbabalik sa normal. At syempre, medyo kinakabahan tayo dahil meron pa rin COVID. Pero mukhang marami sa inyong nakangiti na ng konti. Mukhang gumaganda na yung sitwasyon. But of course, we always have to be vigilant and we have to keep up our guard. Huwag tayong magpapabaya, no? Kasi nandyan pa rin. So, samahan nyo kami. Pag-uusapan po natin ay itong mga natamaan ng Odette at saka ano pang gagawin natin dito pag may mga evacuations at meron pa rin COVID, no? So, stay with us. We've got some really good speakers for you, some of your favorites. Sige. So, Raymond, over to you.
Thank you, Dr. Susie. For those who are joining us for the very first time, we usually put our discussion into context by presenting po ang ginagawa po week in and week out ng ating TVUP team. It's what we call the person on the street interview videos. Ang katanungan po that we pose to the common person on the streets will be, kung may surge at may kasabay na sakuna, ano ang dapat ng mga unang paghahanda ng pamilya? Please watch this.
First of all po, dapat po ihanda natin yung mga basic needs natin like yung food, yung mga medical, yung mga related sa medicines, then yung halimbawa nga may surge sa cases ng COVID-19 pandemic. Tapos nasabay pa yung mga natural disasters. So nag-prepare din kami ng mga face shields, face mask, tapos yung mga alcohol.
Meron po, ang una po talaga naming ini-imbak ay yung mga gamot po. Halimbawa, paracetamol, yung mga first aid na gamot. Halimbawa, magkaroon ng lagnat or ubo at sipon.
When it comes to family, I really think na importante na everyone na trained tayo for emergency situations.
Sineseparate na po namin yung mga importanteng dokumento po nakalagay sa isang envelope na nakasili.
we should practice na lang din yung ating safety measures, safety protocols na nakaset. Laging magsuot pa rin ng face mask, magtabi ng alcohol kung mayroon, at panatilihin na malayo pa rin sa ibang tao, lalo na kung hindi nyo naman sila kailangan kausapin. Siguro, let's make use of the technologies that we have to minimize po yung contact natin with other people if we can lang naman.
May array of hope po ako nakikita. For example, pag we elect deserving leaders na magkakaroon ng systemic, scientific at comprehensive solutions to cope up with this pandemic.
Mas maganda na ihanda yung pamilya, yung yung pag-iisip nila, yung kanilang emotions, dapat ihanda para kung sakaling kailangan man nila lumikas, maiwasan yung panic. Dapat handa rin yung mga elders ng pamilya to reach out dun sa mga barangay. Dapat alam nila yung mga programa na pwedeng makatulong sa kanila bago at pagkatapos sumalanta ng isang trahedya.
Thank you very much. Always nice to see the view of ordinary people. I think meron tayong mga go bag lagi pag may disaster, di ba? Ngayon, medyo iba na ang go bag natin dahil may COVID. Pero pag-uusapan natin yan. Sige, Raymond, i-announce muna natin yung Mentimeter.
Yes, thank you, Dr. Susie, and thank you po sa ating TVUP for that wonderful taking of the pulse po through our person on the street video. For our Mentimeter code for today, lalo na po sa mga sumusubaybay po at jumojoin po sa ating webinar through YouTube and Facebook, ang ating Menti code for today is 42059716. That's 42059716. We ask all of you to open your browsers and go to www.menti.com and enter the code when prompted so you'd be able to participate in our online quiz. For those in Zoom, meron po tayong Zoom fun quiz which we will be tackling the questions po later on after our opening remarks speaker. Dr. Susie?
Okay, we will go right away to our opening remarks speaker kasi excited tayong marinig yung mga magsasalita ngayon, especially our opening remarks speaker. So it's my honor and pleasure to introduce somebody I've known for the longest time. Original team po ito ni Johnny Flavier. He was the Undersecretary for Hospitals and introduced hospitals as centers of wellness back in the day, tagal-tagal na. And he was former Undersecretary. He was also PGH Director. And I would consider a very good colleague and friend who's always around to help, and napakalalim ng mga iniisip niyan minsan. Dr. Johnny Nañagas. Juan Nañagas. Yes. Johnny, go ahead.
Yes, thank you, Susie, for that introduction, bringing me back to the past and inviting me to give the opening remarks in this session of Stop COVID Deaths on COVID-19 and disaster preparedness. Hello to all participants and especially members of our panel today, participants from here and abroad, members of our panel from the DOH, UNICEF, Manila, UP Manila College of Public Health. They will be properly introduced later. I feel that as opening speaker, I may have set the tone of the session with a little bit of history. Disaster preparedness is not a new topic and has always been in the minds of public health practitioners since the Philippines has been one of the countries that experienced many disasters throughout the year. In the mid-90s, I think that was our time, Susie, the DOH launched a program called Stop Death. It's a long acronym for strategic and tactical options to prevent disasters, epidemics, accidents, and trauma for health. Parang sounds like Stop COVID Deaths, no? It envisioned a system which would prepare the country from the barangay level upwards for disasters and was a forerunner of the DOH, Bureau of Emergency Management. This program was so well received by WHO that they invited 4 Filipinos to attend their first international course in disaster management in Switzerland and become pioneers in disaster management, not only here in the country, but even in other countries. Again, about 20 years ago, the National Defense College of the Philippines gave me 3 choices for my thesis in the master's course in National Security Administration. I chose the topic on bioterrorism and broadened it to the topic of tasks and roles of the health sector in biological events. I found at that time a lack of real preparedness in the health sector, not just the government part, for what we term biological events, and COVID is a biological event, such as bioterrorism, biological accidents, and, as I said, COVID as a pandemic. At that time, there was interest in the topic since the CIA accused Saddam of stockpiling biological weapons. We saw that at that time, there was no definite organization, laboratory facilities, and protocols for the health sector. Many other theses followed on related topics such as biosecurity and the formation of armed forces of the Philippines units dedicated to dealing with biological events. Presently, we are hopefully seeing the end game of a contest between COVID and the rest of the world. We experienced dealing with COVID in the disaster situation of Odette, which should teach us valuable lessons in how to address not just COVID, but future pandemics in preparing for disasters. The volcanic eruption of Tonga also gave us lessons in preparing for disasters. Relief efforts there were constrained by the fact that at that time, Tonga had only 1 case of COVID. So what will happen if you let positive relief givers enter the country? They did not want COVID introduced into the country to further complicate the disaster that they experienced. In Odette, the danger of rapid spread in evacuation sites could have been a possibility. The lack of communications, logistics, power, and basic needs presented a problem for COVID response. What do you do when hospitals, other health facilities, and even evacuation centers themselves are devastated? When your personnel themselves are the victims. In Odette, we saw various agencies of the government, the private sector, NGOs, and foreign governments help the people of the ravaged areas. But who orchestrates this? Odette provides us with real-life experience for us to evaluate how communications, logistics, finance, international aid, command and control, and we can make future plans grounded on our experience. But I feel we should have a more far-sighted view of the future, or else the lessons will be lost to us. More than 100 years before Typhoon Yolanda or Haiyan, a similar devastation had already occurred in Tacloban, as recorded by the then Jesuit weather experts of the time. But we stayed in the same locale. Perhaps what we should do is to look for new locations for communities that are exposed to disasters, to safer areas. We should draft and implement new designs for hospitals and other health facilities, and come up with new administrative paradigms dealing with funds and personal transfers from in future disasters. Lastly, a definitive major role should be assigned to the armed forces of the Philippines, as many other countries have done for their armed forces. Hopefully, in discussions such as this session, we will be able to come up with playbills so to address COVID or any other pandemic and any disaster in the future. With that, let me end and listen to our panelists.
Okay, thank you very much. That's Johnny Nañagas, former Undersecretary, former PGH Director, and we'll be sharing a lot more of his insight later at our open forum. So I think, Raymond, we're gonna do the Mentimeter quickly. Sige.
So
Kasi our next guest, will come on board. Go ahead.
yeah. Thank you,
Amen.
Dr. Susie. For those who are in Zoom and in Facebook po, no, we have the Mentimeter. Can we have that on the screen? Thank you so much. We again have two questions here. The first question reads, which of the following needs to be improved or need to be reviewed and updated for disaster response and rebuilding when there is a COVID surge and a disaster such as flood, earthquake at the same time? So, there will be more than one answer. The options are as follows: physical space, option 2, ventilation, option 3, infrastructure resilience, option 4, water sanitation and hygiene facilities, option 5, energy supply such as electricity, fuel, option 6, mental health, psychosocial support, option 7, caring for the carers, option 8, food security, o umulit pala yung food security, and then option 9, coordination. For our second question po, thank you. What are the different lines of coordination in disaster response? So the options are as follows: the local government unit or LGU, armed forces, option 3, private sector, option 4, international organizations, and option 5, non-profit. We will not be closing our fun poll as we move on to our very first speaker who will set the tone for our discussion.
Okay, thank you very much, Raymond. Of course, I can't avoid liking those cute answers on the Mentimeter. Pero tuloy-tuloy pa rin nating sagutin yan, ano, kasi we do these fun quizzes para meron tayong takeaway message. Okay, my honor, my pleasure to introduce a very, very important person for those who are who know him, particularly in the Visayas and Mindanao, really a on-the-ground Undersecretary for Field Implementation Coordination of the Department of Health. Ito po ay hindi na nanatili sa opisina, laging nandun po sa community, no? At alam po niya kung anong nangyayari. And, we're very happy na paunlakan niya tayo na very busy, but he has come to share what's happening and his insights on disasters and this pandemic surge. So it's my pleasure to introduce and welcome Dr. Abdullah Dumama o si Okang Dumama. Welcome, kapatid. Kamusta ka na dyan?
Maraming salamat po. Maraming salamat po.
Sige, go ahead.
Okay. A'udhu billahi minas shaitani rajim. Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi ta'ala wabarakatuh. A disaster is a disaster is a disaster. No matter what kind of hazard it is or it may be, whether natural, human-induced, technological, or biological in nature, it is what it is. One thing is definite though, it creates and leaves behind damages and losses, and those are the risks. Ladies and gentlemen, I'd like to extend my courtesies to all our guests and followers, especially to my idol, Dr. Susie Mercado and Dr. Carmencita Padilla, former Undersecretary Nañagas, and all the people behind the TVUP, for without whom this may not have been made possible. No, it is an honor to be invited in this event. Next slide, please. So 2 years ago, all of mankind were devastated by a pandemic in COVID-19. What started as a pandemic, as an epidemic, in a remote province somewhere in Asia, spread like wildfire across the globe, crippling the regular activities of our daily living. Too late in pointing fingers on who to blame. We all have our our hands on it. No? Our country has been in a battle to mitigate and ultimately stop the virus under the framework of PDITR, which is prevent, detect, isolate, treat, and reintegrate. Next slide, please. But we are coping with the seemingly unsurmountable demands of the disease. Even with our limited resources, we managed to keep afloat and survive through the whole of nation, whole of government, and the whole of society approach. This is where the Bida solution and the rest bakuna come in. B, bawal ang walang mask. I, isanitize ang kamay. D, dumistansya ng 1 metro sa katabi. A, alamin ang tunay na tamang impormasyon at magpabakuna laban sa COVID-19. The minimum public health standards coupled with the vaccination campaign remains to be our primary arm in fighting the virus. Next slide, please. Ang patuloy po nating pagsunod sa mungkahi ng mga eksperto, ng mga dalubhasa sa larangan ng epidemiology at surveillance at ang ating mga pinuno tungkol sa MPHS at bakuna, kasama na po dyan yung IATF at NTF, ay siyang naging gabay natin upang tayo ay makabalik sa ating dating pamumuhay. So sa kabuuan po, meron ng humigit kumulang 127 million doses ng bakuna laban sa COVID ang naibigay sa ating sa buong bansa. Ito po ay base sa datos ng January 31, 2022 at hindi pa rin natin naibigay lahat ng mga dapat na mabakunahan, no? Para sa kaalaman na lahat, as of today, ang fully vaccinated po natin is about 59 million or 66% of the target. 80% na po tayo ngayon or 89 million Filipinos should be given this bakuna, no? So we respect their decision. So yung mga hindi pa ho, but you stop in encouraging those who are still hesitant to get their jobs immediately. So next slide, please. Now, going back to my statement, a disaster is a disaster is a disaster. Responding to a disaster in a pre-COVID times is already difficult. Imagine being deployed to an area where all basic needs are damaged. Lifelines, namely water, electricity, communications, roads and bridges, and infrastructures are compromised or totally non-functional, not to mention sources of physiologic and security needs like food and shelter are lost. It is a nightmare. Now, given our geographical location and susceptibility to natural hazards like typhoon, earthquakes, and volcanic eruptions, we must prepare in order to prevent these catastrophic situations and worse, a condition having a disaster within the disaster. And this is what happened last year with the Typhoon Odette. No? Please remember, we are in a pandemic. And again, we were warned of its coming long before its arrival and should have prepared because this activity is very crucial. On December 16, 2021, Typhoon Odette made a landfall across various islands in the country, including regions Caraga, Northern Mindanao, Eastern, Central, and Western Visayas, and Mimaropa. The devastation is shocking as reports came in days later. Reality is, lifelines are either slightly functional or totally non-functional at all, hence the delays. Although the typhoon was catastrophic, it left a relatively low number of deaths and injuries compared with other typhoons in the past. In fact, to cite some figures, there were only about 14 deaths reported a day after the onslaught. No, that was mainly caused by landslide and drowning. So until hanggang January 20 po, nagkaroon po tayo ng 53 deaths recorded from various causes. Most commonly, acute gastroenteritis with severe dehydration and some other causes. No? Next slide, please. 3 things were essential to be established immediately in order to manage and mitigate the event. One, command. Second, communication. And third is control. Not necessarily in that order. The DOH is quick to, next slide please. The DOH is quick to respond by one, reactivating the DOH Central Office Health Emergency Management Operations Center and the counterpart regional HEMS operation centers even prior to the crisis. Number two, pre-positioning strategically supplies, drugs and medicines to the nearby areas where the typhoon will hit for easier dispatch. Number three is sending in rapid health assessment teams and some essential supplies and resources to, of course, to hardly hit areas. So in close coordination with other government agencies, we managed to move resources using available government assets and secure the availability of which to the affected areas. Now, next slide, please. Post-assessment and analysis revealed that we need to deploy. So, the quad cluster teams, water, sanitation and hygiene or the WASH, mental health and psychosocial services or MHPSS, nutrition in emergencies or NIE, and the medical team with their supplies were sent in batches. Normally, we would have dispatched all available resources immediately so we can bounce back sooner. That's normally in normal situation. However, because of the present condition, the DOH is responding more calculatedly under the premise of preventing the spread of COVID-19 infection. However, we responded in a timely manner to the best of our ability to immediately to the immediate needs of the affected communities, such as deployment of personnel to augment the workforce, no, because the health workers were also affected. Next slide, please. Another infection control measures were made, no, over the already imposing demands of health emergency response to ensure the safety among responders and the community as well. To wit, number one, every member of the responding team must secure a negative COVID test result before dispatch. Number two, all members of the operations are closely monitored on a regular basis for any signs of influenza-like illnesses or the so-called ILI and immediately secured following the existing guidelines and protocols of the IATF and of course the local government units. Number three, we set up triage areas prior to consultations. Number four, there's a need to provide dedicated isolation areas for cases and completing quarantine period for prescribed after showing positive result using the rapid antigen test kits. Number five, active contact tracing of people exposed to a COVID-19 case. Number six, but last but not the least, deteriorating patients, no, with COVID cases are immediately transferred to higher facilities for appropriate management. Banking on the success of the preventive measures implemented before the typhoon, where the BIDA solution and which are the BIDA solution and the Res Bakuna initiatives, the department continued with mass advocacy on abiding with the MPHS and continued with the COVID-19 vaccination campaign. Next slide, please. Now, for the purpose of this presentation and discussion, I would like to take Caraga region as a case study because it is the hardest hit by the typhoon. Next slide, please. Caraga region has a 2020 projected population of 2.753 million, 2,753,109, and as of February 1, 2022, it has a total of 59,396 confirmed COVID cases, 53,499 to be exact, of whom have recovered, 1,469 deaths secondary to COVID, while about 4,428 cases are still active now. In comparison to the regional vaccination coverage, it's on the screen, there are about 1,359,000 first doses of about 67.73%. 1,277,000 were fully vaccinated, or about 57.66%. With only 83,000 as of the moment, 741 booster doses were given, of about 3.69%. Now, comparatively, Caraga has accomplished a significant number of first doses for its eligible population. However, we still need to cover the remaining eligible population to complete their primary doses, while encouraging those who have already completed their primary doses to have their booster doses. Yeah. This will eventually bring us closer to what we wish to achieve for the region. Under this vaccine coverage condition, the department is in full support to minimize interruption in the campaign and ramp up the activities simultaneously with the health emergency responses. And bringing the vaccines stood as a great challenge because of the unstable to no power source in the field. The cold chain management will be deeply compromised, thereby compromising the vaccine's integrity as well. Contingency plans are made and immediately implemented to address this concern. Generator sets were dispatched as temporary solution while awaiting for the full repair of the more stable and sustainable power generated by the electric power plants. Next slide, please. Now, looking at all the other areas of concern, like the evacuation centers, health facility status, waste management, mental health and nutrition in emergencies, the department is working in close coordination with the LGUs and all other partners and stakeholders through the local operation centers in the field. In this case, the Caraga CHD, or Center for Health Development Operation Center. This is where all directions emanate with regards to health emergency responses within the region. A counterpart operating unit could also be found in other government agencies following the Incident Command System or the ICS. The ICS allows for interoperability of languages and applications across and between operation centers, as it is anchored with the same operating system. This makes it relatively easier to identify responsible persons and their functions in the organization. Likewise, this eliminates duplication and uncertainties, unnecessary losses because of command, communication, and control over the crisis. This harmonizes responses and coordinates activities for faster and more efficient delivery of necessary supplies and services. Technically, the operating procedure and activities rendered are present and based on available resources from the national to the local government, as well as also from the partners and stakeholders. With the pouring of support and assistance from all concerned individuals and groups, it is imperative to have a system which directs all traffic and avoid confusion in an orderly, stressful, and chaos-filled environment. Next slide, please. However, all these activities do not necessarily equate to results dissimilar with theoretical explanation. The barometer will still be the actual condition of the end users or the recipients of the services. In this case, international standards on setting up evacuation centers provides all basic needs for displaced individuals and families, including but not limited to ample spacing, privacy, safety, and security. And in times of COVID-19, the provisions are even higher. There are more things to consider, like intensified infection control measures, strict enforcement of physical distancing, prompt identification and isolation of suspected cases, dedicated quarantine areas for recovery, etc., etc. And we want to prevent an outbreak within an outbreak. Within a disaster, such as water and vector-borne diseases, vaccine preventable diseases, or else it would be a double whammy for all of us. The current condition of displaced families in evacuation centers are far from the international standards, but we are surviving. It is our aspiration to provide the best assistance we could extend, but we are tied up financially. You know that, no? Totoo pong napakahirap napakalaking hamon para sa lahat ang paggamit ng mga international standards. Now, working and living condition under these challenging working and living under these challenging conditions are additional burden, not only for the responders and leaders, but more so for the victims. Nevertheless, the responders are doing its best effort to deliver needed services for them. Ang karanasan na ito ay nagbigay ng pagkakataon para sa ating lahat upang mamulat at matuto. Kabilang sa aking mga napagtanto at naging inspirasyon kung bakit ang mga susunod na aking mababanggit ay ganito. Kapag ang COVID at sakuna ay nagtagpo, kailangan nating bumuo ng isang matatag na public health response. Tayo ay kumikilos ngayon base sa mga health response plans bago pa man nagkaroon ng pandemya. Sa makatuwid, kinakailangan maiangat ang planong ito upang maging akma sa mga pangangailangan ng pagkakataon. Sa tulong po ng mga IATF at NTF resolutions, naging mas mahigpit at maingat ang ating responde upang mapangalagaan ang kaligtasan, una, ng ating mga respondents, ikalawa, ng mga biktima ng sakuna. Next slide, please. Tapit na po. It still may be a separate interim guideline at the moment, no? But we are pushing for its actual incorporation of these precautionary measures to the revised health response plan. I hope for the creation of an operational guidelines on responding to to disasters in times of COVID-19. And this should include, but not limited to, 1, quad cluster approach plus COVID framework, yung PDITR, plus vaccination. And then the National Patient Navigation and Referral System, there was a approved EXICOM resolution that asking for the issuance of the executive order po. Nung Wednesday lang po ito para may palabas yung National Patient Navigation and Referral System. Pangatlo, dedicated COVID-19 resources. Dapat kasama to, availability of PPEs, testing kits, complementary human resources for health, transport vehicles and ambulances, quarantine areas, area for zoning, and things like that. The same time, approval of the national EO of the National Patient Navigation and Referral System, na-approve din po yung giving the authority to the regional directors and the chief of hospitals, medical center chief to procure or purchase transport vehicles and ambulances. So magiging sana ho matupad dito para magkaroon po tayo ng dedicated vehicles for that. Number 4, it was under my order, the FICT Vispin order, that says minimum number of days of health emergency response deployment for at least 10 days, because there were some responders before and during Odette, nagkaroon po ng problema dahil 3-4 na araw lang po na malagi yung ating mga responders. And I was a little confused because parang hindi ko po makita ang dahilan o kung ano ang kanilang magagawa sa 3 o 4 na araw. So dapat ho medyo magtatagal tayo sa isang lugar na katulad doon dahil pinag-aaralan po yung mga replacement kung saan sila i-deploy. And then yung deployment of cadres are based on local needs. Magtanong ho tayo, bago tayo magpadala, magtatanong tayo anong kailangan nila mga cadres at yun ho ang ating ipunin at yun ang ating ipapadala. More importantly, this compendium of policies and guidelines, protocols and procedures should be well appropriated. Meron na ho ata ito, o sana magkaroon pa, well disseminated and well implemented with corresponding penalties for non-compliance. So next slide please. Hindi po hadlang ang pandemya upang tugunan ang hinaing na tulong ng mga biktima sa sakuna. Kailangan merong kamalayan sa nakaambang panganib dulot nito upang maiwasan po natin ang pagkalat ng impeksyon sa pamamagitan ng maagap at akmang paghahanda. Pero po gusto ko pong sagutin yung tanong natin na may COVID na, may bagyo pa, paano na? Yung aking pong sariling sagot, huwag nating gawing dahilan ang COVID-19 para maantala ang pagtugon sa epekto ng bagyo. At huwag rin po nating gawing dahilan ang bagyo, huwag nating gawing dahilan ang bagyo para lumala ang COVID-19. No? With that having said, I wish to thank you for your undivided attention and listening. It's always a humbling experience to be of service to you. Mabuhay po tayong lahat.
Okay, thank you very much. That's Undersecretary Dumama. Nako, napakahusay ng presentation niya, no? At tinitingnan ko lang yung mga larawan ng mga lugar na nasa lanta. Talagang kahit na anong paghahanda ang gagawin, pag ganong kalakas ang bagyo, talagang mahirap, no? Tsaka I think USEC Dumama also showed us na ang daming kailangan isipin, ang daming kailangan gawin sabay-sabay, no? So, Kang, thank you so much for joining us. I know you have to go, pero nagpapasalamat lang kami na napaunlakan mo kami. Maraming salamat. Marami po kaming nakitang anggulo na napakahirap din talaga ng response ng ng pamahalaan pag ganyan kalakas ang bagyo at ganyan katindi ang COVID. So thank you so much and more power to you, kapatid. See you soon. Okay, we're going to our next speaker. Our next speaker is an expert, all right, and well known in the international circles. We're very proud of her. When we think about UNICEF and a Filipina making a mark in UNICEF, isa lang yung may isip namin, itong doktorang to, na she was working in the WHO office for a while, but she's been working in UNICEF and has been working on the area of child protection. And we are very, very happy to have with us someone who's very active in the response for not just COVID-19 but for Dept, no? Dahil marami pong bata ang natamaan ng sakuna. Sila po ay nasa mga evacuation center. Kamusta na po sila? Yung po ginagawa ng UNICEF, no? Tumutulong po sa ating pamahalaan. I'd like to welcome Dr. Mariella Castillo. Yella, welcome to the webinar and please go ahead.
Thank you, Susie. How's my audio? Okay naman?
Very good. Yeah, it's good.
Thank you. And salamat yung introduction na nahiya naman ako. Magandang hapon po sa inyong lahat. I am sharing my screen. I hope you can see this. Slideshow na ba?
Yeah, it's good. You're good to go. You're good to go, Yella.
I'm Dr. Yella Castillo. I am very pleased to share with you some stories from the field, from the UNICEF lens. As you know, UNICEF started out as a humanitarian organization after World War II. And actually 75th year na po ng UNICEF in the Philippines. And as mentioned by Yusek Dumama, tuloy-tuloy talaga ang disasters, and now we have disasters within disasters. So I'll share with you some stories from my colleagues who were out in the field in Caraga and Region 8, Southern Leyte. How is it to respond to an emergency in the midst of the COVID-19 pandemic? Ang nakikita niyo po ay isang scene from the port in Southern Leyte. On the right-hand side, nakikita niyo yung Limasawa Island, and the calm of the sea does not give you a hint of the destruction that Typhoon Odette, with the international name Super Typhoon Rai, wrought on Limasawa Island. So these stories are shared by my colleagues from the different sections of UNICEF. Dahil health is one of the major areas affected, but nonetheless, there are also other children's rights that are deprived of them, especially in humanitarian situations and emergencies. And I'd like to give credit to my colleague, Dr. Mark Kiazon, who is also a fellow UP alumnus, who helped me develop this presentation. So in the area that was hit by Typhoon Rai, the UN OCHA, or the UN Office for the Coordination of Humanitarian Affairs, was developed this humanitarian needs and priorities document. So in that area that Yusek Dumama mentioned, diba, from ranging from Region 13, Caraga, up to Region 4B, or Mimaropa, there were 16 million people in those affected areas. And the projected number of people who are in need is around 2.4 million. With the request of the Philippine government through the NDRRMC for international assistance, we have crafted this humanitarian needs and priorities that is supposed to target 840,000 people for assistance, because these are those in the worst affected areas, with a number of 70 mostly local-based organizations, because it's important to also enable and empower local-based organizations for both response and recovery. SO stands for strategic objectives. So the assistance has 3 strategic objectives. The very first is to save lives by providing immediate integrated humanitarian assistance. After the immediate phase comes the rebuilding. So the second strategic objective is to restore livelihoods and access to critical services to promote the rapid recovery of the most affected communities. And the last strategic objective is meant to address and advocate the specific needs of the most vulnerable subgroups. These are the people based on gender, age, disability, displacement, and other vulnerability criteria, so that they're protected against violence and have equal access to humanitarian aid without discrimination. So the photos that you see are the scenes taken from Limasawa Island in Southern Leyte. I hope, and for me, this brings back memories of Typhoon Haiyan or Yolanda, itong sa Southern Leyte. Southern Leyte was actually spared by Typhoon Yolanda, but the scenes are very similar. Yung mga coconut trees na talagang naputol, para na lang silang mga pencil, at saka yung mga all the houses completely destroyed. And so the blue ones you see, one of the immediate needs are really the need for tarpaulins, no, to serve as the temporary roof covering, because as you know, around the time of December 16, 17, we also had some La Nina rains, as well as the ongoing COVID-19 pandemic. The path of Odette crossed around 11 of the 17 regions. Just wanted to go over some numbers with you. And if you see to the right of the number, mayroong arrow, no? Yung green arrow. And that shows the trend. Because the extent of the damage, and Yusek Dumama alluded to this, the extent of the damage was not evident at the beginning of the assessments. And actually, there's some of them are still ongoing, not just the immediate effect of Odette, but the ongoing effects, because the damage has been so extensive, it affected access, it affected roads and utilities, so that there's secondary damage from the typhoon. So there are 9.2 million people affected. I'll just get my pointer. And it's increasing. To date, there are 406 deaths. 169,000 people are displaced from their homes, but they are slowly returning to their homes. As of end of January, there are only now 110,000 people inside evacuation centers. And one observation of the team is that the evacuation centers actually just serve as tulugan, because during the day, occupancy of the evacuation centers is very low because the families go to their houses so that they can do some repairs, or they go around to earn some money or get some food for the family. There were 1.1 million damaged houses, 420,000 destroyed houses, and agricultural damage is estimated at $312 million US, while infrastructure damage is around $336 million and rising. Just wanted to show here the path of Typhoon Odette on December 16, 17, and also some scenes of the total destruction. These are scenes from Dinagat Island. We wanted to show this a slide that compares Typhoon Haiyan or Yolanda with Super Typhoon Rai or Odette. Definitely, there were more people affected in Typhoon Haiyan. In terms of displaced people, there were more people displaced in Typhoon Haiyan. But the most interesting statistic for me on this table is the number of deaths and injuries. We have learned our lesson, no, from Typhoon Haiyan in 2013. And the preemptive evacuation really worked. No? There were 6,300 deaths in Typhoon Haiyan, with 1,000 missing and 28,000 injured. But in Super Typhoon Odette, there were only 406 deaths. Still one death too many, but definitely much fewer compared to Typhoon Haiyan. 65 people missing and 1,300 injured. I mentioned that the extent of the destruction is still is only becoming clear as more roads are cleared and access to the the innermost parts of the affected areas are possible. So in fact, Typhoon Odette, there are more houses damaged compared to Typhoon Haiyan. And in terms of the number of municipalities affected, hindi nagkakalayo yung dami ng mga bayan, no, na apektuhan ng Typhoon Haiyan at ng Typhoon Odette. You know that Typhoon Odette is the 2021's second deadliest disaster. Pumapangalawa lang po yun sa Haiti earthquake. So as mentioned, in situations of extreme disaster, the clusters are activated by government. And so UNICEF is the co-lead in the nutrition cluster, the WASH cluster, child protection, and the education cluster. And these are some of the scenes of destruction that you can see, no, from Dinagat Island. So for nutrition, this is co-led by the National Nutrition Council, and the target or the foreseen needs of for nutrition are 133,800 children at risk of severe acute malnutrition. There are identified needs for health for 2.4 million people. The health cluster is led by the DOH and co-led by the World Health Organization with support from UNICEF. And the same number of persons identified to be in need of wash or water, sanitation, and hygiene services. Close to 1 million children in need of protection services. Not only are they displaced, no, or separated from their families, but they're also at risk of child abuse, especially in areas with prolonged displacement. And then education was, of course, disrupted, no, with about 711,000 children in need of support for education in emergency. So for nutrition, some of the immediate response needs are the provision of supplies. So yung tinatawag namin life-saving nutrition commodities and supplies include ready-to-use therapeutic food and ready-to-use supplemental food. There's provision of the age-appropriate and nutrient-rich complementary foods and diets for children 6 to 59 months, as well as appropriate energy protein supplementation and the iron, folic, or multiple micronutrient supplements for pregnant women and breastfeeding mothers. There were also actions, no, to promote and support optimal infant and young child feeding practices, or IYCF practices in emergencies, including the implementation of EO 51 or Milk Code. This is the Philippine law that regulates the donation of milk, of breast milk substitutes in emergencies, because the use of these powdered milk in the context na there is not enough water, sanitation, and hygiene, as well as cooking, clean cooking supplies, will actually lead to more diarrhea and more deaths among children. And just as important is the dissemination of life-saving messages among the parents, the caregivers of infant, young children, and adolescents. And because we foresee that there will be more children who will be suffering from severe acute malnutrition, there needs to be regular assessments or screening and surveillance for children, pregnant, and breastfeeding women. And what you see on the screen is the use of the mid-upper arm circumference tool. It's a simple measurement that will screen for children at risk for or already suffering from malnutrition. So what are some of the adjustments that was made in this response? Because there was also a COVID-19 surge towards January, at the end of December, around the time that the response was being conducted. Yusek Dumama earlier mentioned yung mga IATF measures for all the teams that are responding. And in terms of the operational response, it also means integrating infection prevention and control training or strengthening in all the activities. The use of the mid-upper arm circumference measurement is favorable in emergencies to screen for malnutrition because the contact time with the child is shorter, and at the same time, you can train families to do the MUAC measurements on their own. Next will be the response in health, and we're showing you some of the temporary clinics that were set up on Siargao Island, specifically in Pilar. So tents were provided to serve as access points for essential health services because, as Yusek Dumama reported, there was complete destruction of the health centers and the barangay health stations on the island. So not only that, the tents are set up to provide community and mobile health service delivery points There's also the need to augment the medicine and medical supplies in the affected communities. And here's an important intervention for health assistance, which is to support the strengthening of disease surveillance. In emergency response, there is normally activation of the disease surveillance, especially for those that you will see in evacuation centers and among displaced population. So ano-ano yung mga sinusurveillance? So the surveillance for acute watery diarrhea na nangyari na nga, di ba? There was an outbreak of acute watery diarrhea in Siargao as well as in Surigao. But here, we now incorporate surveillance for COVID-19. One of the other essential actions is the support to immunization. No? There's supplemental and catch-up immunization and the provision of appropriate information for culture and gender and age so that there can be improved practices for the prevention of COVID-19. For the prevention of COVID-19, we had to provide PPEs for both the communities and the frontline workers, and the modular tents were provided, and I'll show this to you in the next slide, as well as training on infection prevention and control. So aside from the, for COVID-19, aside from the provision of PPE, the tents also had to comply with both the need for physical distancing. So usually there are 72 square meter or 42 square meter tents. So the actually there's a greater demand for the bigger size tents. And also the tent design was also upgraded so that it can withstand 200 kilometer wind speed. And the picture below shows the modular tent. We have the modular tents pre-positioned so that those who are in evacuation centers can use the modular tents for isolation as well as for privacy. For disease surveillance and appropriate management, there was a need to augment also the human resources for disease surveillance, and especially taking into consideration that the most common cause for consultation are cough and colds after the disaster. And in the context of COVID-19, that also needs to be appropriately reported and tested. And this was a situation where the testing was limited or compromised in this area. So the need to network so that the appropriate management of these patients can be conducted. There's augmentation of health human resources. We know that the frontline healthcare workers, the barangay health workers, the daycare workers were themselves affected by the disaster. There's a need for mental health and psychosocial support for the healthcare workers and frontliners. There's a need to support the cold chain to maintain the integrity of the vaccine. So in many of these areas, there were also COVID vaccines that were in the area and that needed to be in the proper temperature. So some of the support is, was mentioned earlier, the provision of generator sets, the fuel for the generator sets. And for the future, there was also provision of solar-powered refrigerators. And also the need for risk communication and community engagement, because we need the support to communities to practice infection prevention and control. WASH is an important support in disasters and emergencies because the lack of potable water increases the risk of waterborne illnesses. So UNICEF delivered water treatment solutions, jerry cans, hygiene and dignity kits for families most affected in Dinagat Island as well as in Southern Leyte. So you can see here the distribution of these supplies. This is the one in South Leyte Provincial Health Office in Maasin. And this is distribution of the supplies in Siargao Port and in the DOH Caraga office. I won't go over the list and you can just read it yourself. I'm moving on to the next slide, which is some of the COVID-19 adjustments or considerations when we responded to the need for WASH. and that is the inclusion of the COVID-19 disinfection kits among the supplies that are provided to institutions. The family hygiene kits that used to contain, soap, toothpaste, toothbrush, etc., now contain COVID-19 add-ons, and these include masks, both for children and adults, alcohol hand rub, and materials for surface cleaning and disinfection. And in the messaging, there's an important, we emphasize the importance of hand washing to prevent COVID-19. There were many schools that were completely destroyed or partially destroyed, but at the same time, the schools were also used as evacuation centers. So there's approximately 711,000 children in need of education and emergency support. So some of the response activities included the provision of temporary learning spaces, and that means also the tents. We also, Typhoon Odette also destroyed all the school materials and modules. So there's also the provision of the school in a box learner kits and other kits for learning. There was training conducted for teachers and daycare workers on education in emergency, as well as awareness raising activities on education continuity and school reopening. And then also mobilizing the community so that they can help strengthen they can help prepare for school reopening. So some of the COVID-19 adjustments that were made were the incorporation of the infection prevention and control measures for learning spaces, ensuring that there was PPE available, there's physical distancing, there's good ventilation in the tents, and availability of the hand hygiene equipment, as well as helping the schools and the district offices for the return to school and the school reopening. Then lastly, there was support for child protection. This is a very devastating event, and there was a lot of stress and fear and anxiety and trauma. So some of the support included the implementation of the child-friendly spaces, and there's a protocol for the child-friendly spaces that was developed by the Child Protection Cluster led by DSWD. There's provision of mental health and psychosocial support to the affected girls, boys, parents, and caregivers, orientation on psychological first aid and other MHPSS interventions for both families and community members, and activation and implementation of the SOPs for the continuity of child protection services. And that means empowering women and child protection units in the area and other child protection service providers to provide these services. So just to show you some of the interventions, this is not in Typhoon Odette affected areas, but just this was in the Typhoon Rolly Ulysses area. So this is what happens in the child-friendly spaces. So there's trained community and youth volunteers to conduct MHPSS activities for the children. And the child-friendly spaces also had to comply with the physical distancing as well as the ventilation requirements to prevent the spread of COVID-19. So our adjustments made include ensuring the incorporation of these IPC measures in the child-friendly spaces. Some of the activities to bring child-friendly spaces to the communities had to be done in smaller groups. So it had to be done either modular or mobile because there were restrictions to the number of people that could be gathered because of the COVID-19 IATF rules. And certainly there's a heightened need for mental health and psychosocial support and protection services due to the prolonged confinement of children during COVID-19. So all in all, the response considered adherence to the protocols and guidelines by providing PPE to both beneficiaries and non-beneficiaries, meaning the responders. We had to comply with the current IATF protocols on requirements, protocols and requirements on movement. There's need to limit face-to-face activities so that we can manage the risk of infection. And then we needed to support the application of IPC measures in evacuation centers and in the communities. And we saw the need to prepare evacuation centers apart from the schools and TTMFs. Those are the temporary treatment and monitoring facilities. So apologies for going over my time limit. That's my sharing of stories from the field. Maraming salamat po sa inyong pakikinig.
Thank you so much, Dr. Mariella, for your stories from the field. It's something that we don't get to hear much of every day, and hopefully that's something that resonates with each of our audience members po. Dr. Susie?
Oo, ang ganda nga eh. Sabi ko nga, naku, I think for both of the presentations we have, talagang eye-opener, no? Ang daming kailangan adjustment na gagawin dahil sa COVID. Mahirap na ngang magresponde doon sa sa displacement. Pero maganda namang makita, no, may mga tent na may social distancing, may physical distancing and all of that. But really an eye opener. Thank you very much. It was an excellent presentation, Yana. Thank you. Raymond, over to you.
Thank you, Dr. Susie. And for our last speaker po, no, he'll be giving a talk. His specialty is in emergency medicine, also one of the professors over at the College of Public Health, the Department of Health Policy and Administration. Please welcome again to the webinar, Dr. Carlos Gundran. Dr. Charlie?
Hi. Good afternoon, everyone. Thank you, Raymond, for that introduction. Can I share my screen now?
Go ahead, sir.
Okay, so good afternoon again, everyone. Nakita po natin, no, very colorful yung presentation ni Dr. Dumama at ni Dr. Castillo, no, regarding the response during Dept, no, in spite of the COVID pandemic, no. And makikita natin yung hirap, makikita natin yung mga uniqueness ng kanilang mga ginagawa, no? And tingnan nga natin kung kaya natin explain, no? So we have to accept the fact that sometimes we can prevent an incident from occurring that would lead to a disaster, no? Hindi natin pwedeng sabihin sa sa lindol na huwag ka lumindol, hindi natin pwedeng sabihin sa bagyo huwag ka muna pumagyo dahil meron pa kaming COVID, no? So ang incident mangyayari yan, hindi natin siya pwedeng pagbawalan, no? So despite na meron tayong COVID pandemic, hindi ito magiging deterrent para hindi bumagyo, para hindi lumindol, or hindi ito dahilan para hindi mangyari ang ibang hazard incidents, no, from taking place, no. And isa pang malaking fact about this Typhoon Dept is na-wipe out yung mga health facilities sa mga dinaanan niyang areas, no, sa lugar. Okay. So balikan ulit. Gusto ko kasi emphasize, no, pag alam natin yung problema, alam natin kung ano yung solusyon, di ba? So kailangan nating i-define again ang disaster. So ano nga ba ang disaster para maayos yung ating response, no? Again, ito ay isang insidente na ang magnitude niya ay na-interrupt ang activities ng isang community, di ba? Like for example, may bagyo, walang pasok, no? So natitigil ang normal na gawain or activities sa isang community, no? Tapos hindi pa nagtatapos doon. Para maging disaster ang isang insidente, dapat hindi natin kaya, di ba? It's a situation wherein the coping mechanisms of the affected community is not enough, no? Kasi pag sinabi mong kaya mo, hindi disaster yan. Emergency situation lang yan, di ba? Incidente lang siya. Ang disaster, isang insidente na hindi mo kaya, no? Ngayon, pag naintindihan mo yung pangalawang aspeto, hindi mo kaya, paano ka makakabangon kung hindi mo kaya? Kailangan mo humingi ng tulong, di ba? External assistance is required to recover. So, alam na natin ang disaster isang insidente na hindi natin kaya. Para tayo makabangon, kailangan natin humingi ng tulong, no? So kaya importante in disaster management is nagtutulungan tayo. And kung makikita ninyo, di ba, tumutulong ang UNICEF, tumutulong yung mga ibang ahensya ng gobyerno kasi hindi nga kaya nung nasalantang community makabangon on their own immediately. Tapos meron pang dalawang karakteristik ang disaster na gusto kong maintindihan ninyo. Nalaman natin na hindi mo kaya, so may mismatch, di ba? Mas malaki yung problema kaysa sa kapasidad mo. Kumbaga, ang kalaban natin sa disaster ay higante lagi, no? So, winawasiwas tayo ng higante, wala tayong kalaban-laban, no? Pero, ang pangalawang aspeto, ang mas matindi actually, no? nagkakagulo, di ba? So, ang ibig ko sabihin dito nagkakagulo chaos, lahat tayo magandang intention natin sa disaster, no? Kaya lang kuminsan, pag nagkakanya-kanya tayo ng response, hindi nagiging effective yung response natin, lalo lang tayo nakakadagdag sa kaguluhan. Kumbaga, limited na nga yung resources natin, hindi pa natin na i-distribute ng maayos, no? So, yan ang ibig ko sabihin kayo. Maganda man ang hangarin mo, gusto kong tumulong, di ba? Gagawin ko yung gusto kong gawin, pero in the big picture, hindi siya actually maganda. Nag-a-add siya sa chaos, which is a characteristic of disaster, mismatch and chaos. And na-mention ni Dr. Dumama kanina na importante yung command, coordination, at saka yung control para masagot ang chaos, para magkaroon ng order. Di ba? So, paano yung pangalawa actually ang pinaka-importante, no? Paano natin masasagot yung chaos, no? Chaos, dapat lagyan mo ng order. Paano ka magkakaroon ng order? Dapat meron kang incident command system or tinatawag nating gobyerno. Meron kang mga sinusunod na mga batas or patakaran, no? And para ma-address ito, no? Ang latest Republic Act natin is the 10121, no? Sino ba ang in charge sa pag-response at coordinate ng mga response in disasters, which is the NDRRMC, di ba? The main coordinating agency, no? So yung incident command or siya yung lead agency para magkaroon tayo ng order, no? So ang ibig sabihin ito, siya yung lead, no? Siya yung pinaka-in charge. Okay. Pero under NDRRMC, sino ba ang in charge sa sa response? PSWD, no? Sino ang in charge sa prevention and mitigation? DOST. Sino ang in charge sa rehabilitation recovery? NEDA, di ba? So, merong mga vice chairs sa bawat thematic areas na magiging in charge. And kung titignan natin, sino ba yung mga members ng NDRMC? Andito yung DOH, di ba? Member, DNR, Agriculture, Education, lahat actually, di ba? Kasi lahat tayo important in the response. Like for example, ngayong pandemic, although ang in charge is, ang expert dito is Secretary of Health, yung DOH, di ba? Pero kailangan mo lahat ng agencies to help. Department of Transportation, yung law and order, yung military, lahat yan importante. Agriculture, kasi wala tayong kakainin, di ba? So, kailangan kasi coordinated tayong lahat, hindi tayo nagkakanya-kanya, no? So, kumbaga, to address the chaos, kailangan natin ng incident command, and sa Batas ng Pilipinas, RA 1121, ang in charge actually during response sa disasters is NDRMC, pero meron siyang mga different thematic areas na nagli-lead, and depende kung anong klaseng incident, yun yung gagawing parang strike team force, no? Like for example ngayon, ang IATF advisory ang ang medical or the DOH, no? So that's it. Okay, ano pa? Surveillance. Pagka geophysical, TVUP, pag hydrometeorological, pag-asa, terrorism, ASP, epidemic, o pandemic, DOH, di ba? Civil disturbance, PNP, pag-infestation, Department of Agriculture. So, in the big picture, di ba, lahat yan nagko-contribute, no? Meron tayong supposedly structure, no? So, that goes with the big picture, the national picture, no? Ngayon, we have in UP Resilience Institute, no? Merong programs and functions concerning multi-hazard, multidisciplinary, multi-sectoral, comprehensive disaster risk reduction and management, no? So, ginawa siya in response to climate change, pero lately kasi hindi lang actually hindi lang preparedness at saka academe, no? Lately nagre-respond na rin ang UPRI, no, sa mga dito sa mga disasters, like for example itong UDEP nag-respond din ang UPRI, no? So hindi lang naiiwan sa academe ang Resilience Institute ngayon, no? Napipilitan na rin silang mag-respond. Kasi bakit nga? Ang problema natin yung disasters, kulang eh. We need all the resources we need, no? Okay. So UP Manila, branch naman, no? UPRI, lahat ng campuses may kanya-kanyang specialty. Ang Los Baños is agriculture, di ba? So lahat yan may DRR, no? Now, in terms of health, na DRR, ang in charge is siyempre UP Manila. And in UP Manila, we have researches and simulation exercise na related to disaster and health in the UP Manila DRN Center. Sige, next. Health Emergency Management Bureau, ito yung sabi ni Dr. Dumama kanina, di ba? Ang DOH ang response agency niya in disaster is the HEMS, no? HEMS, Health Emergency Management Bureau, acts as the DOH coordinating unit and operation center for all health emergencies and disasters, as well as incidents with the potential for becoming an emergency, and coordinating the mobilization and sharing of resources. No? So kung kulang ka ng hospital, kulang ka ng supplies, kulang ka ng doktor, anong kailangan mo health-related, bagsak lahat ng hospital mo, sino ang mag-coordinate niyan? Siyempre yung HEMS na, no? For DOH. No? So ito yung response agency ng DOH. So if you want to coordinate, no, remember, according to structure, para meron tayong order, the government, DOH, babagsak sa DOH, sino? Yung HEMS. Now, gusto ko lang idagdag din, ano? Ang mga hospital natin, no, should be the last building standing after disasters, no? And makikita natin ito sa safe hospitals ng WHO na inadapt din ng Pilipinas, no? So anong vision? To protect the lives and health of people from emergencies and disasters by, di ba, continuing to provide healthcare services in times of emergency and disasters, no? So dapat continuing nagko-function ang hospitals natin even after every disaster, maging radionuclear event yan, maging bagyo yan, maging pandemic, no? So dapat maging malakas na lindol, di ba? So dapat ang mga hospitals natin resilient siya, na kahit na anong impact ng isang disaster, dapat makakabangon ulit siya at magpapatuloy ang kanyang serbisyo sa mamamayan natin, no? So yan ang diktum ng safe hospitals, no? Hospital should be the last building standing after a disaster, no? May impact din kasi ang ospital, no, sa psyche ng isang community, no? Pag alam mong meron pang ospital, di ba, may hope eh. May hope yung mga tao, no? So, yan din ang isang isang purpose, kaya dapat nagfa-function ang hospitals after disaster. And meron tayong guidelines from WHO, and meron din tayong local guidelines na Philippine indicator, no? So, ano yung sinasabi sa safe hospital? A safe hospital will not collapse in disasters, will be able to continue to function and provide critical service in emergencies, will be organized with contingency plans in place and health personnel trained to keep the network operational, no? So aning example natin dito sa Typhoon Odette, na wipe out ang ating mga hospitals, no? So dapat siguro i-rebuild natin yung mga hospital to comply with the safe hospital standards, na para hindi na ito mangyari sa susunod na disaster, no? Kasi mangyayari ulit yung bagyo sa Pilipinas, especially sa Pilipinas. And kung titingnan natin, merong Philippine version na, ang Hospital Safety Index, no? So ma-download nyo actually ito online, no? So na-i-publish siya December 2016 pa actually, no? So kung gusto niyo i-check yung inyong hospitals, kung it will be able to withstand earthquake, no? At saka yung strong winds, nandito yung mga indicators mo, no? If you want to rebuild your hospitals better, no? To be able to comply with the safe hospitals na para mag-function kayo the last building standing after a disaster. Ngayon, I would also like to add, no, meron kasing HA 204 sa CPH, no, sa MHA Masters in Hospital Administration, merong HA 204 class na ang title is Hospital Planning, Design and Maintenance, no? And this hospital planning, design and maintenance, it talks about everything on how to build a hospital, where to build the hospital, paano yung form niya, what is the best way to do it, saan maganda yung, may mga zonings pa silang sinasabi, no? Pero I would like to focus on 3 that is related to disaster. Lecture number 3, which discusses hospital designs for the new normal, no? So it already took into consideration ano ba yung mga adaptations mo sa new normal, which is meron silang 5 main parts, no? Which is number 1, clean room design, no? You regulate the concentration levels of airborne particulate through temperature, pressure, and humidity control. Number 2, healthy room design, design and function to facilitate hygienic practices, no? So yung mga hand washing stations, yung mga alcohol, mga yan. Yung mga sausawan ng paa na disinfectant bago ka pumasok sa isang room. Number 3, expandability. Modification of spaces to accommodate patients during surge, no? Like for example, gagamitin mo yung isang room, no? Para maging additional ER or yung hallway. Flexibility, modification of the use of space. Like for example, yung parking space gagawin mong additional COVID ward siguro, no? And number 5, automation, no? Automation is ways and means to reduce human interaction. No, like for example, telemedicine, no, para wala yung face-to-face interaction, yung possible transmission ng virus, or yung mga BP monitor, or yung mga pagkuha ng temperature na automatic na nakadikit na sa pasyente para hindi nalapitan ng healthcare providers, no. So these are added designs for hospitals to face the new normal. Lecture 11 about fire safety naman, and then lecture 12 again yung sinabi ko kanina, which is safe hospital. Now, so maganda din yung diniscuss ni Dr. Ella kanina, no? In response ng UNICEF, no? Napaka-comprehensive, napaka-disiplinado, napakaganda, no? And kung titignan natin, no, kung gusto niyo gayahin yung kanilang response, no, actually merong dictation or merong mga guidelines sa sphere, no? Sphere guidelines, humanitarian charter, and minimum standards in humanitarian response, no, on how to respond humanely in a disaster zone, no. So basically, kung camp management, meron ka mga evacuees, dinidiscuss ito ano ba yung tamang shelter and clothing, water and sanitation, ano yung mga important na food and non-food items, paano yung vector control, paano yung vaccination, and your medical treatment, no. So if you want to see the principles kung bakit ganun mag-respond ang UNICEF, and gusto niyo gayahin, actually dito niyo makikita yung basic guidelines, no. I-download niyo lang Sphere guidelines, no, yung latest, no. And sa shelter and clothing, for example dito, diba, shelter, the ideal space requirement per person in an evacuation camp is an area about 3.5 square meters. So hindi pwedeng sobrang congested. Actually, mas maganda nga yung pinakita ni Doc Ella kanina, na modular na yung mga tents, no. Meron ka ng privacy, dati kasi hindi gano'n. Now, you have to consider again the new normal. So mas malaki pa ngayon yung space. Water requirements, no? So survival, no? 2.5 to 3 liters per day, no? Pag maliligo ka, another 2 to 6 liters per day. Isama mo pa yung pagluluto mo, an additional of 3 to 6 liters per day. So total basic water consumption per evacuee mo is nasa 7.5 liters to 15 liters. So kung meron kang 300 people, i-multiply mo lang sa 7.5 to 15 liters, ito yung requirement mo for water. Kung gusto mong potable water lang, consumption, nasa 2.5 to 3 ang computation mo. So makikita mo ito sa Sphere Guidelines, page 118. Sanitation, binibigyan ka na rin ng computation. Excreta, gano'ng karaming dumi per person per day. So sinasabi nito, 1 to 2 liters per person per day, or 40 to 19 liters per person per year, no? So solid waste generation, kung tatapon ka ng basura, nasa 0.5 kilograms per day per person. So importante yung water and sanitation, kasi kung madumi yung paligid mo, di ba, nag-invite ka rin ng sakit niyan, no? So, dinidictate din ilang ba yung dapat number of toilets, no? So 1 toilet for every 50 person pag communal, no? Or medium and long term, dapat 1 toilet for 20 person. Food and nutrition, diniscuss din ni Doc Ella kanina, important yung nutrition kasi maraming malnourished, no? So, merong definition ng acute malnutrition, moderate malnutrition, severe malnutrition, no? So, depende sa measurement, no? And then meron ka din syempre nutritional guidelines for this, no? So, sinasabi din, ano ba ang dapat nare-receive ng isang tao per day in an evacuation camp? In terms of energy, nasa 2,100 calories, no? In terms of protein, nasa 53 grams per day, and so on and so forth. Vitamins and minerals. And also micronutrients actually kasama diyan. For vaccination, di ba? Kailangan may vaccination ka for the diseases with outbreak potential like measles, mumps, rubella, chickenpox, and kasama na rin yan ngayon ang COVID, no? Vitamin A at saka DPT. No? So importante din ang vaccination sa evacuation area dahil congested ang mga tao, madaling hawahan dito yung transmission ng communicable disease, more so pag COVID ang pinag-usapan natin, no? Okay. Medical treatment, meron din silang guidelines, ilan na dapat yung community health workers per 1,000 people. No? So dapat meron kang 1 to 2. Births attended by skilled personnel, no? So ito yung mga standards natin for medical treatment na makikita ninyo sa Sphere guidelines, no? So moving forward, no, we have to incorporate the new normal in the response in evacuation centers, no? So dati lang sa sphere guidelines, mas mahirap pa ngayon eh. Dahil kailangan mo i-take into consideration yung normal, yung diniscuss ni Dr. Dumama kanina, yung BIDA, diba? Yung PDICR. Tapos i-add mo pa ngayon yung vaccination against COVID. We have to build and rebuild hospitals following the safe hospital guidelines and design for the new normal. Yung makikita natin sa HA204. No? So kung nasira ang mga hospitals, kailangan yung sigurong i-rebuild dito, build back better, ika nga natin, di ba? And tingnan nyo na yung safe hospitals guide, no? Or yung Philippine indicators ng safe hospitals, no? Para mas resilient na ang hospital ninyo. Para next time, di ba, your hospital or your healthcare facility will be the last building standing after disaster. And alam natin na ang characteristics ng disaster, ang mas pinakamabigat na problema is yung chaos, di ba? So, merong value ang coordination. And in coordination, may value ang communication. Dapat nag-usap tayo. Binanggit din ni Doc Ella kanina yung risk communication at saka ni Dr. Dumama, di ba? Importante actually yung communication. And we have to support our frontliners. And eventually, siguro ang pinaka-best investment natin dito is to educate the community. No? So simulan natin sa bata. Malaking investment siya, matagal na investment siya kasi pagka matanda na, mahirap nang baguhin yung behavior niyan. Pero pag bata pa, kaya mo pang i-mold yan. Katulad ng ginagawa nila sa Japan, bata pa lang, dinidisiplina na nila. Kaya pagdating ng emergency or times of disaster, maayos silang kumilos. Hindi nag-aagawan, pumipila pag pinapapila. So I think yun lang po ang aking reaction for today, and these are my references. Yung Hospital Preparedness for Emergency, yung RA101, yung BPRI, Safe Hospitals, and yung Philippine Indicators, and then yung HA204, Hospital Planning, Design, and Maintenance, and yung SPHERE Guidelines. No? So with this, I thank you very much for listening, and I return back the control of the to you, Raymond. Thank you very much.
Thank you, Dr. Charlie. Thank you also for introducing our disaster risk reduction and management for health na NICER project po, of which you lead. Thank you so much. We will now be asking all of our speakers po, to open up their cameras. But before that, we have our public service announcement. Over to you, TVUP.
Mahalaga ang lakad na ito. Tigasin ka ba?
Siyempre!
Mahal ba si Commander?
Mahal na mahal! Pare, mahal mo ba ako? Oo naman, ano?
Mahal mo ba ang tropa?
Oo ba?
Tara na! Magpapakuna na tayo!
Dahil mahal ko kayo, magpapapakuna ako.
Thank you, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by our UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the DOST-PCRCRD and the Department of Health through the AHEAD HSPR project. Dr. Susie?
Yeah, thank you very much. Raymond, thank you very much. Charlie, I really also enjoyed your presentation. Maganda yung yung definition mo ng yung disaster, no? Nakakalimutan natin na kaya nga siya disaster kasi pati yung health workers dun sa lugar na yun ay nasisira ang bahay nila, nasasalanta sila, no? And so, sometimes people are quick to judge and say na kasi hindi tama ang paghahanda. Nako, pag ganun namang kalakas ang bagyo, paano gagawin natin, no? So anyway, I wanted to start this discussion a little bit by asking Dr. Nañagas. Kasi ito si Johnny, nag-USEC for Hospitals, no? Nag-director ng PGH. At trained ng Armed Forces, no, sa disaster response. When we look at it, I think the difference between what we faced in the 90s and what we're facing now is, of course, not just COVID, but also climate change. And so I think my question for the three of you, you give really good presentations. How do we respond so that we're not overwhelmed? Kasi it's overwhelming eh. Pag tiningnan niyo yung sakop, yung dami ng kailangan gawin, paano ba tayong hindi ma-overwhelm nan? So I think I'll start with Johnny. Parang in your view, no, and you can see from your many years of work in the health sector what works, what doesn't work. But now we have what works, what doesn't work, and more trouble. So how do we respond so that we're not overwhelmed? Kasi we cannot help but feel na ang hirap naman, kaya nga yung title paano na ba, 'di ba? What do we do so that we're not overwhelmed? Sige, Johnny, ikaw muna.
People might find it radical or parang too much, no? But I was looking at our history. Like yung Hayan happened before, 5,000 people died 100 years ago. Same spot, but then we built in the same spot, no? So I was thinking that maybe it may be time, especially with climate change, to start relocating our communities. Look at Indonesia. They're transferring their capital away from Jakarta, no? If you're going to think about the next 20, 50, 100 years from now for the Philippines, I think it's time to think of more parang strategic thinking, no, na magbibigay sa ating mga tao ng part of their resiliency, no? Parang hindi ba kung sa prevention tayo, bakit ka pupunta sa response if you can prevent, hindi ba? So sa akin parang gano'n but that takes a lot of thinking and action.
So parang strong leadership, no? I mean, I agree with you, Johnny, no? Sa Climate Change Commission kasi pinag-uusapan the actual distance of communities from the coastal areas, no? And 70% of our people live in coastal areas. Should be about 2 kilometers. Parang ganun kalayo dapat yung tinitirahan ng tao. Kasi yung nangyayari, ayun nga, tsaka yung mga lugar na binabaha, nasasalanta, hindi na dapat pinababalik ng mga tao doon. Pero ang nangyayari naman, yung mga tao kusang bumabalik. But then I don't take that as an excuse because I recall back in the day, pag pumutok ang bulkang Mayon, maraming namamatay. Pero natutunan natin na pwede tayong gumawa ng zone na talagang wala talagang titira doon para wala talagang mamamatay, no? Zero deaths. I don't know, Charlie, what is your thinking on this?
Doc Susie, kasi hindi talaga natin mapipigilan yung mga tao maski nasabihin natin na bagyo na yan, binaha na yan, natabunan na yan ng lahar, bumabalik pa rin yung mga tao kasi doon yung kabuhayan nila. And then bigyan nga natin sila ng alternate community. Pag wala namang lifeline, walang trabaho, wala silang kabuhayan, walang tubig, umaalis din sila doon at bumabalik din sila doon sa pinanggalingan nilang delikado dahil natin nga yung kabuhayan nila. So mahirap na problem nga yan. At saka isa pa, ngayon kasi hindi na katulad nung 100 years ago na hindi ganun kakapal yung population natin. Di ba dati pagka binagyo, binubuhat yung bahay para ilipat sa bayanihan, para ilibigay sa lugar na hindi binabagyo. Pero ngayon, hindi mo na pwedeng gawin yun. Pag ginawa mo yun, squatter ka na. So, masyado na din po kasing madaming tao, no? Sa mundo, nag-aagawan na tayo sa space. And kung saan yung space na may kabuhayan tayo, doon tayo nagsisiksikan. Which is, kaya nagkakaroon ng congestion, kaya nagkakaroon ng pagka nagkaroon ng hazard or nagkaroon ng insidente, maraming namamatay. So, hindi ko rin alam kung paano natin susolusyonan ito Ang laki-laki ng space na available sa Pilipinas, pero hindi naman natin ma-distribute ang population natin evenly. No? Kasi may mapupunta sa liblib na lugar. No? So, mabigat na tanong actually yan for me.
Overwhelming ba? Na-overwhelm ka sa tanong? Yela, what do you think? Tingnan natin si Yela.
Overwhelming nga. Oo nga. But let me just on a more practical aspect, no. So number one, when I was preparing for this lecture, meron naman talaga ng mga regulation, Philippine policy on the no-build zones. And as Charlie said nga, no, it will take political will, especially that the response will be very localized, no. So it's LGU level political will and for national government and also organizations that support LGUs to enable the LGUs to implement these policies. Pero on a more practical note from the health side, paano tayo hindi ma-overwhelm? Yung parati nating sinasabi pa from Typhoon Yolanda, yung Build Back Better. Ang concrete example ko kasi dyan yung maintaining the cold chain. Yung mga refrigerators na bakuna para hindi mapanis kapag nawalan ng kuryente. So there are many things you can do. You can get solar-powered refrigerators. You can get solar as a source of power. Yun ay talagang maha-harvest natin sa Philippines. So, but these require investment. And also part of the long-term planning will be the networking. We've seen this in this response and even in Typhoon Yolanda, yung magmo-mobilize sila, magta-transfer sila ng mga bakuna to an area that has electricity or to a facility that has a generator. So if that is something planned beforehand, then it's something that can add to the resiliency of the health system. We also mentioned yung parang partner or twinning of areas, and UNICEF Dumama alluded to this, yung kapag nakulangan ng healthcare workers, lahat sila apektado in one region, then there's an identified region that can back up. No? Usually, Region 5 ang pinakahanda dyan eh. Dahil sanay na sanay sila sa hasang-hasa sila dahil sa pagsabog ng bulkan, di ba? But they're the ones that are at sa Bagyo. So they're the ones that are really mobilized to be on the ground within 24 hours to support another hospital. So yun, preparedness is really one way to do it. Over.
Yeah, thank you, Yella. I'm gonna go back to Dr. Nañagas, no, Johnny. Yang twinning ng mga hospital. Noong 1990s ginagawa na natin yan, di ba?
Oo. There was the government hospitals noon, and even some private hospitals agreed on even the sharing of equipment and personnel during disasters, because when a health facility is overwhelmed, even its equipment is overwhelmed. No, so but I don't know if this is now formalized, as in everybody knows where to go and what equipment can be loaned or lent. I remember we were loaning a lot of, for example, oxygen regulators kasi nauubusan yung iba. So, yung mga ganun madali. But I also mentioned before yung administrative changes, no? Kasi for example, there was a time we were going to Bicol because of an eruption by Mayon. Hindi pala kami makaalis kasi wala sa aming merong capacity to handle money. So we had to get someone from finance, kasi may mga bond yan eh, who had to be bonded to be able to handle the finances of that group. No? So those are small things that I think can be low-hanging fruits that can be handled by local governments and the national agencies that help them. Yung design ng hospitals, minention ni Charlie, I think there's an architectural group that's volunteering to help in designing hospitals. No? But even the choice of where the hospital should be carefully studied, kasi sometimes our hospitals are located in a site that was donated by someone, so wala silang choice. No? So maybe it's about time that we study what would be the best local for a hospital, so that even with a typhoon, with a disaster, with an earthquake, they will not be devastated.
Yeah, thanks a lot. No, I mean, I think parang this webinar really opened our eyes to so many facets, no? Maraming angulo, no? Pati yung cold chain, ano? Parang pag naisip mo walang kuryente, di walang kuryente, di ba? Paano yung lahat ng bakuna ng COVID-19 na nandun? Kaya sinasabi naman niya, sige, solar panel natin yan, ano? Parang, I think there's like the low-lying fruit, the things we can do immediately. But I do agree with you, Dr. Nañagas, na because we are so disaster prone and because the sea level rise in the Philippines is 4 times that of the world, hindi na pwedeng patumpik-tumpik lang tayo eh. We really need to, the losses for Odette was in billions. I think, I don't know, what was I reading? 300 billion ba or something like that, no? Parang, parang lumuluhod na tayo dahil sa COVID-19, binabagyo pa tayo, no? So I think, even through this little webinar, we start talking about it, but I think some drastic measures are needed. And then, of course, for our frontliners who are all watching, no, parang at the level ng pamilya nyo, dapat meron din kayong mga plano, no? Parang meron tayong mga earthquake drill eh. Siguro kailangan meron tayong drill ng bagyo with COVID. Yung parang ganon, complicated na yung drill natin. Anyway, Raymond, over to you.
Thank you, Dr. Susie. We have one question. Actually, I just saw in the Q&A that we have Roy Visco from Business Mirror, but we're still waiting for his question to come in. We have a question coming in po from PGH. The question is, since we are regularly in the path of typhoons, what measures are in place to prevent infection outbreak in evacuation centers? Are the 3 C's that help hasten transmission of infection are being addressed, such as crowding, close contact settings, and confined and enclosed spaces with poor ventilation? Okay. Who wants to take that up? Maybe let's ask Dr. Mariella.
Si Ella yata yan eh. Oh.
Thank
So,
you,
Mariella.
Raymond. There's a similar question pa dun sa Q&A. Kasi yung tanong, how do we ensure? And then yung isa naman is, will we continue COVID vaccination? Actually, yung sagot will be the same, no? The observation of the minimum public health standards, yung distancing, wearing of mask, and then there are maneuvers like yung fixing the scheduling so that the vaccination centers will not be will be able to manage the foot traffic and all that. So we also regularly participate in the National Vaccination Operation Center meetings, or the NVOC, and we know that that the resumption of the COVID vaccination in the Odette affected areas is really a priority. Kasi nga inuunahan natin na dumami pa sa Omicron. And for the question related to evacuation centers, I hope I mentioned it already, that there are already existing guidelines, and I think Yusek Dumama also mentioned this in his slides, no? Yung guidelines for the prevention of COVID aligned with the PDITR strategy for evacuation centers. Over.
Okay. Thank you very much, Yella. Ay nako, Raymond, wala na tayong oras. I think we will have to start wrapping up, but I'd like to thank all of our speakers. We're going to give you a couple of minutes to think through a parting message for our audience, many of who are frontliners. But before that, Raymond, let's answer the fun quiz. Tingnan nga natin kung tama ang sagot ng ating mga online
Can we have that
communities.
on the screen? Okay, and can we also have the mentee on the screen? Okay, thank you. So we have 2 questions po, no? Just like our previous webinars. First question here, it reads, which of the following need to be reviewed and updated for disaster response and rebuilding when there is a COVID surge and a disaster such as flood, earthquake at the same time? So, ito po yung options natin. There are 9 options. So, alin po dito ang mga tamang kasagutan? We'll ask let's ask Dr. Charlie for this question.
Thank you, Raymond. No? Which of the following needs to be reviewed and updated? Actually, tingin ko lahat. Lahat sila. No?
Okay. Thank you, Dr. Charlie. For the benefit of those who are outside of Zoom, like Facebook and YouTube, ang top answer po, at least for the Zoom one, 76% chose water sanitation and hygiene facilities. That's followed by, pareho po ito, mental health and psychosocial support and ventilation. Sorry, may physical space pala, just above that, very very slightly. Dito po sa Menti, ang ganun din po ang most chosen po na answer, water sanitation and hygiene facilities. There are 3 na 11%, which is ventilation, mental health and psychosocial support, and communication lines po. For our second question reads, what are the different lines of coordination in disaster response? Ganun din po. Dr. Charlie?
Okay, lines of coordination, nakita naman natin kanina yung RA 10121, di ba? Merong chain of command, merong line of command, and then syempre yung communication, ganoon na rin. Meron tayong lines of communication. And all of these are actually part of that chain of command, that incident command.
Okay. Thank you so much, Dr. Gundran. Over to you, Dr. Susie.
Okay, thank you so much. So we are now going to ask our panelists. Are we going to evaluate muna, Raymond? Parang nalito na ako. Evaluate muna. Yes,
Sige, we'll open the evaluation
Yan, sana umaandar na ngayon na. So, okay, so we would like to ask you to evaluate. Raymond, go ahead. This is yours.
The 5 questions po for this webinar on COVID-19 na, may bagyo pa, paano na, are as follows. And we're using a 4-point Likert scale po. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Dr. Susie?
Mukhang okay naman ngayon, ano?
Medyo namamatay-matay ulit. We'll just keep it on, Dr. Susie.
We'll keep it on. Okay, so let's go to our panelists and ask them for their parting words. For us, we're going to start, of course, with Charlie. Dr. Charlie Gundran. Charlie, go ahead.
Again, in-emphasize ko po na ang disaster ay isang insidente na hindi natin kaya, na importante po na tayo ay nagtutulungan. Importanteng ma-recognize natin na kailangan natin humingi ng tulong, and kailangan nating maintindihan na dapat tayo lahat nagtutulungan, hindi nagpapagalingan or nag-aaway-away. So yun po siguro yung pinaka-message ko in disaster. Cooperation po, collaboration, and communication.
Thank you very much. That's Dr. Charlie Gundran of the UP College of Public Health. Yella, go ahead.
Thank you. First is that from our learnings and our experience, we really have most of the needed policies in place. We really need to do a better job of disseminating down to the barangay, local government levels, these policies that exist, and these are the guidelines that are also life-saving. And then that second, that it's the disaster and the response does not occur in isolation, and so the importance of the multi-sectoral response. But from the UNICEF side, I also have a special message, a shout out, that schools should be the last to close and the first to reopen. COVID or disaster, they really mean a lot for children, both for safety and for development. Thank you.
Thank you very much. That's Dr. Yella Castillo of UNICEF. Okay, our final message is from USEC and former PGH Director Johnny Nañagas. Johnny, go ahead.
Yes, I've learned a lot from the discussions here, but the last statements by our speakers, I think, bring home the point that everyone should work together. It's coordination, even in just the government agencies that respond to disasters. Overwhelming ang dami. So it has been mentioned that command, control, communication, I think, is very important and should be continued even when there is no disaster, to ensure that it works during disasters.
Okay, thank you very much. That's Dr. Johnny Nañagas. And I think now we're going to, I'd like to thank everyone, first of all, and we're going to have a brief summary by the Chancellor of UP Manila, Dr. Menchit Padilla. Menchit.
Magandang hapon po sa inyong lahat. Former DOH Undersecretary and former PGH Director Johnny Nañagas opened today's webinar. And Dr. Johnny said that disaster preparedness is not a new topic since the Philippines is a victim of disasters for decades. And way back in the 90s, he recalls that a DOH program called Stop Death addressing disasters in the country was already put in place. And as a matter of fact, this led to the development of the Bureau of Emergency Medicine, or rather, Bureau of Emergency Management. Dr. Johnny, in his master's studies, realized in his thesis that indeed there was the urgent need to review the tasks and roles of the health sector, both government and the private sector. And indeed, there was a glaring lack of understanding of dealing with bioterrorism and other disasters, and there was a lack of facilities to support disasters in general. So with Typhoon Odette, he said, we should learn how to deal with disasters better because we are dealing with a disaster in the midst of the COVID-19. And this is an excellent opportunity to review communication, logistics, command and control. And indeed, we also realized with Typhoon Odette that the evacuation centers are likewise victims. Dr. Johnny ended by saying that we need a more far-sighted view of the future to plan better, referring to better designs, avoidance of disaster-prone areas, and a more definitive responsibility for the armed forces of the Philippines. Our first speaker is Yusek Oka Dumama, who said that we survived Odette because with the whole of nation, whole of government, and whole of society approach. In the midst of the typhoon disaster, Yusek Dumama reminded us the importance of public health standards together with vaccination as primary measures since COVID-19 is still in the midst. So he said, remember the slogans, be the solution and res bakuna. Yusek Dumama said the government is doing its best to attain international benchmarks or standards on the successful response, but it has been very challenging. So allow me to quote Yusek Dumama on his comments on the impact of Odette. He said, mamulat at matuto. Kapag ang COVID at sakuna ay nagtakpo, dapat mas patatag ang public health response. Dapat iangat ang pagresponde para nakaakma ang response. Yusek Dumama is hoping that soon the operational guidelines response during COVID-19 will be signed and approved. And the summary slide of his talk actually gives the highlights. The first is the quad cluster approach, plus COVID framework, plus vaccination. Number 2 is the National Patient Navigation and Referral System. Number 3 is a dedicated COVID-19 resources, and that means availability of PPS, testing kits, complementary human resources for health, transport vehicles and ambulances, and the isolation and quarantine areas, as well as the area zoning. Number 4 is the minimum number of days of the health response, emergency response deployment for at least 10 days. And the last is the deployment of the cadres based on local needs. So at the end, you've got the national response, the regional response, the provincial response, but we have to listen to the ground, and that will be the local one. So Yusek Dumama ended by saying, huwag gawing dahilan ng COVID-19 sa pagresponde sa bagyo at huwag gawing dahilan ng bagyo sa pagkalat ng COVID-19. Our next speaker is Dr. Mariella Castillo, who shared stories on how to respond to a disaster in the midst of a COVID-19 pandemic. And her colorful stories center on the following strategic objectives of UNICEF. The first is save lives by providing immediate integrated humanitarian assistance and protection to those in the most urgent need. The second is to restore livelihoods and access to official services to promote the rapid recovery. So in other words, help does not end with the immediate response. We've got to look beyond and look at the livelihood because they have to go back and continue living. And the third one is to address and advocate the specific needs of groups of people based on gender, age, disability, displacement, or vulnerability criteria. Now, the only thing I'll mention will be the responses that she mentioned on top of the usual disaster response, because she said that the UNICEF had to come up with COVID-19 consideration and adjustments. And just allow me just to mention some of them. And you have to go back and watch the replay. The first is the integration of infection prevention and control in the training activities. And highlighting the children is the use of the mid-upper arm circumference measurements in screening for malnutrition, because this is actually a quicker way and will entail minimal contact with the children. The fourth is the disease surveillance among evacuation centers to include watery diarrhea on top of COVID-19. And what was interesting were the tents, the tents had to comply with distancing. The tents were upgraded to withstand the 240 wind speed. And one thing that the two things that she mentioned that I think we always forget is the cold chain. The cold chain for the vaccines, not only for COVID-19, but the regular vaccines of the children, because we do have to provide the generators. And she did mention the use of solar-powered generators. As we talk about immediate response, we of course, we have to talk about the need for mental and psychosocial support and the need for the distribution of clean water. And maybe the last one that I'll mention is that in addition to the usual kits that they're giving now, their kits contain actually COVID-19 materials that are needed, the mask and the alcohol that are needed. I'd like to make a special mention to the attention to the children, because maybe that's the highlight of UNICEF, giving a focus on children, because recovery will take time and we need to ensure that children receive their immunizations on schedule. We have to make sure that we provide the child-friendly spaces that comply with the ventilation requirements and distancing. And as she said, the school should be the first to reopen, because life has to go on for the children. So one last point I do want to mention about psychosocial support is that the psychosocial support is not limited to the adults. It actually involves the whole community, and that means the families, the community, the children, and those responding to the disasters. So she did give a summary of the things that she mentioned, and I'd like you to go back to the replay, because it will be best to look at her colorful pictures as she talks about the summary of her recommendations. Allow me now to give the summary for Dr. Gundran, who started by saying that we have to accept the fact that sometimes we cannot prevent an incident from occurring that would lead to a disaster. He defined disaster as an incident sufficient to interrupt activities of community, a situation wherein the coping mechanisms of the affected community is not enough, thus needing external assistance to recover. We do have RA 10121, which designates the National Disaster Risk Reduction and Management Council. And I think it's important for us to understand the different roles of the different agencies. But this does not stop us from the private sector or the academe to actually participate, so long as we are aligned with the plans of the council. He made mention of two units in UP being part of UP. We have the UP Resilience Institute. It is an institute that covers all the units of UP. And we do have in UP Manila, the Disaster Risk Reduction and Management Council, which addresses the health concerns for the whole community of UP. The discussion on the safe hospital is very important. I think since all of us here belong to a hospital, or at least one hospital, he said it, he was very clear in saying that we need to make sure that our hospitals are safe. And it has to be, what is a safe hospital? It is the last building standing after a disaster. It will not collapse, killing patients and the staff. It will be able to continue and function and provide critical services in emergencies. There's to be organized with contingency place and health personnel training to keep the network operational. And on moving forward, I think this message is very important to remember. Moving forward, we have to incorporate the new normal in the response and in the evacuation centers. We have to build and rebuild hospitals following the safe hospital guidelines. We have to value coordination to avoid chaos. We have to value communication for good coordination. We have to support the frontliners. And he said at the end, the best investment is to educate the children for change in behavior. I urge you to watch the replay. There are just too many lessons to learn from each of our speakers, and there are personal lessons and also lessons for our hospitals. Allow me to end with messages from first from the person from the street who gave very clear messages to, they said, this is from the people who were asked out in the street. They said, ihanda natin ang ating pamilya. Basic needs, essential medicine, ngayong COVID, pati face mask at alcohol, yung ating mga importanteng dokumento. Those are things that we, even the health professions, must remember because we do have families. And then from all of us speakers, as we have heard from all of them, we are also for the families, for them to be able to proceed with caring for their families. We in administration, whether we are part of a health facility or academe, we have the responsibility to plan better. We must collaborate and communicate better so our plans will work better for everybody. Magandang hapon po sa inyong lahat, and back to you, Susie and Raymond.
Thank you very much, Menchit. Always a pleasure to have you to summarize a very long meeting, but I think we all learned a lot, and for you to give us the takeaway messages. And we encourage you all to continue to watch the replay. No? Thank you so much. Okay, next week. Nako, very good. We're gonna have a very, very well-known infectious disease specialist. We're going to have Dr. Edsel Salvania, who's going to talk about updates on medications for COVID-19. Pag-uusapan yung molnupiravir, yung Paxlovid, at saka yung tocilizumab, and whatever other medications there are. So please invite your friends. We've never had Edsel on Stop COVID Deaths because he's always so busy, but we are finally going to have him on the webinar, so please don't miss it. And so that's Friday next week. Over to you, Raymond. Naku, maraming announcements si Raymond. Sige, go ahead.
Thank you, Chancellor, for summing that up magnificently. Dr. Susie, thank you so much also. We first will have our Heroes Memorial announcement. So that's something that we have done in the past, our call for photos. It's just as a way for us to remember and honor our Filipino medical frontliners. Nasa man po kayo sa parte ng mundo, maraming salamat po, lalo na po yung mga nagsakampo sa COVID-19. If you could share your photos, that would form part of our memorial. We will deeply appreciate it. Next, we have naman po our announcement with regards to our certificate. So nakita ko po sa ating chat, may mga nagtatanong po, may nakatalo ng webinar 76, webinar 82. But at least for our previous 84 webinars, kasi tinatapos pa rin po yung webinar 85, only those who have completed or have attended at least 50% of the webinar duration will be able to receive copies of their electronic certificates po. And then finally, next po, we have our SCD shorts. Our SCD shorts are just our short snippets or clips from our webinars. So kung meron po kayo, especially if you're on the go, maybe you're commuting, maybe nagpapaantok po kayo, etc. That's something that you could consume in a very, very short time for you to be able to just refresh your mind on a particular topic. We also will not be here if not for the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content that form part of what is essential po, and kung bakit po bumabalik-balik ang mga miyembro ng ating credible online community. For those who will want to essentially watch all of these in the playback, lahat po ito ay naka-archive sa ating YouTube channel ng TVUP. If you go to www.youtube.com/TVUPPH, you'll be able to find all webinars 1 to 85, and then right after this one, webinar 86 will be part of that list po. So that's it. That concludes our webinar for this week. Sana po marami po kayo natutunan. Marami din po tayong mga kababayan na nasalanta at still trying to regain a sense of their lives po before Typhoon Odette hit, and that's something that we hope we could be able to extend our help if we could as much as possible, and something that we could really look forward in terms of being able to be prepared for our next bagyo o kung ano man pong sakuna na darating po. So magkita-kita po tayo ulit next week. Very exciting topic. Friday from 12 noon to 2 p.m. It's a date.
Together, we will stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold the